Annual Summit. Once again, I am Jenny Bogard, and I'm the Executive Director of the Roundtable, and I'm so excited to be back with you all today. I am going to kick it over to Eduardo Sanchez, our co-chair of the Roundtable, to welcome everyone and provide a reflection from all the wonderful dialogue that took place yesterday. So Eduardo, it's all yours.
Good morning, everybody. I think that applies at this time pretty much for all folks who are participating. Thank you so much for coming back. Yesterday was awesome. I'm going to start with a quote that is my favorite quote these days. I'm not an optimist. I'm a very serious possibilist. And honestly, what we heard yesterday was about the possibilities. This isn't about creating new stuff. This is about taking what we know and taking what we've seen works in a variety of places and either putting it to work, figuring out the how, or scaling it up. So yesterday was just so awesome. Started with a pre-summit meeting between the National Hypertension Control Roundtable and the Federal Hypertension Control Leadership Council, something that Janet Wright helped orchestrate and put together. I think we collectively hope that this was the first of many conversations to kind of move the needle into the realm of realizing the possibilities. And then we had just an awesome presentation. You know, I'm gonna stop for a second and just reflect on the pre-summit, because there's a couple of things that I wrote for myself. There was a focus on some with regards with polls on some things that maybe seem to be working and fit that category of taking the possibilities even further. One was just generally related to self-measured blood pressure devices and use. One was associated with, I think, more important actually, but it was only a few percentage points difference, and that's team-based care. We can't get done what we need to get done without employing and deploying all parts of what will allow us to realize the possible, including our patients. And then in a close third, the integration of social determinants of health into clinical workforce. And I will comment in advance that the panel discussion in particular, but even the presentation by Dr. Wenger just reminded us that context matters, and knowing the circumstances of individuals allows us to do a couple of things. One, to help figure out what's the right solution for that individual in the moment, but also to figure out what are some possibilities to change the conditions that resulted in that situation in the future in a broader way. So we did have presentations. Nanette Wenger was awesome. Hypertensive heart disease in women. That's an important population to focus on. 50% of the population, quite frankly, those of us men would be here if it wasn't for women. So in so many different ways, that is a biological truth. But that was a really, really important conversation. The epidemiology, the life course, the discussion of socioeconomic factors, and the discussion, a little bit of focus on hypertension and pregnancy, so important. And then the panel discussion afterwards, I think not only was complimentary, but it helped provide further context for the discussion. And so our speakers, our moderator, who was awesome, Dr. Janet Wright, and then the panelists, Dr. Letitia Presley-Cantrell, Dr. Carol Watson, and Marcia Kritzler-Eglin, who was awesome because she brought the patient voice to that discussion to really further provide detail around what we were doing. And today is going to be equally awesome. We're going to be focusing on innovative community clinical practices for health equity. And that's important because it's yet another reminder that context matters, and providing awesome clinical care, while necessary, is not necessarily sufficient, because people live in neighborhoods and people have circumstances and situations that describe them, and community clinic partnership can help create the conditions, the situations, the circumstances for people to get from where they are to where we think they can be. And so today will prove to be another awesome conversation. We'll take a little bit of a break, and then we're going to have a second panel discussion about engaging employers in hypertension prevention and control, a discussion with business leaders. That's near and dear to my heart. Before I joined the American Heart Association, I worked for Blue Cross Blue Shield of Texas. You know, part of what we were trying to figure out is how to engage with those employers / self-insured organizations to move the needle on blood pressure control and other aspects of healthier life. And then we're going to have a group discussion, and then we'll close it out at 2 p.m. Eastern time. I'll stop there and hand it back over to you, Jenny. I hope I covered all the bases. And again, let me just repeat one more time. I'm a serious possibilist, and we have in front of us the information, some of the resources, and certainly the smarts and the motivation and will to move us from where we are to realizing the possible. Jenny.
Eduardo, thank you so much. That was so perfectly and beautifully done and well executed to provide a great reflection. Before I pass it over to Miriam, our moderator, for our first panel of the day, I want to pose one question to the group. You know, there was a lot of responses in our survey from yesterday talking about, well, where do we go from here? How do we actually create action around what we heard from yesterday's discussion? And I'm going to throw that back to you all as you listen to all of the experts on today's panel. What can we do together that we can't do alone? And that really is the beauty of the roundtable, is that we are here. We are a collective group of experts working on the same thing, improving hypertension control. There are a variety of different programs and interventions and perspectives. So I want you to remember that question throughout today, because I'm going to pose it back to you at the end of the day and really hear, like, where do we go from here? I mean, I wrote so many notes, and I know Dr. Wenger talked about this around Women Heart, which is where patient advocates talk and share their stories, is investigate, educate, advocate, and legislate. And I love that because it's powerful, it's verbs, and that's really what we are at the roundtable, is creating and catalyzing that action. So with that, thank you, Eduardo, so much. I am going to introduce Miriam Pitanium, who is